listening to Her Brilliant Health Radio, episode number 14.
She used to deliver babies, but now she delivers exceptional wellness for women. Welcome to Her Brilliant Health Radio, where holistic women's health expert and board-certified OB-GYN Dr. Kyrin Dunston shares revolutionary insight from leading experts on what you need to know today to treat the root cause of disease, heal, and create the radiant health you've been searching for.
Hey, it's Dr. Kyrin, and today I think you're going to love this special guest that I have for you. She's one of my favorite people and one of my good friends, Dr. Anna Cabeca. We have walked parallel paths from OB-GYN to functional, holistic, integrative medicine to virtual care and group programs. And she's now getting ready to launch her book, The Hormone Fix. So we are fellow authors, and I love this woman. I love her soul. I love her personality. I love her intellect, and I'm so grateful that she chose to spend this morning with us, and I think you'll really enjoy what we're going to talk about and learn a lot of wonderful things. Listen in. Hey, it's Dr. Kyrin. Welcome to another episode of Her Brilliant Health Radio. Today, I am so excited to interview one of my favorite people, Dr. Anna Cabeca. So please help me welcome Dr. Anna. Let me tell you a little bit about her. Dr. Anna Cabeca is an internationally acclaimed, award-winning, triple board certified menopause and sexual health expert who has touched the lives of hundreds of thousands of women globally, including mine. With her generous, down-to-earth, faith-filled, authentic presence and easy humor, Dr. Anna naturally inspires women to reclaim their vitality and live a life filled with more purpose and pleasure than they ever dreamed possible. She is the developer of innovative virtual transformational programs, including Magic Menopause, Sexual CPR, and Women's Restorative Health. Her popular superfoods drink, Mighty Maca Plus, is one of my favorite ways to begin each day. I am also a completely satisfied customer of her top-selling rejuvenating feminine vulvar cream for women, Julva, or as I like to call it, Joyful Vulva Cream. Dr. Anna hosts the highly regarded series Couch Talk, featuring compelling podcasts focused on a wide variety of important health and wellness topics. Her book, The Hormone Fix, a diet and holistic lifestyle program for menopausal women, launches in February. She'll tell you all about that. And you'll definitely want to reserve your copy now because they will go very quickly so that you can get the information that you need to age healthily, gracefully, beautifully, and most importantly, brilliantly. Welcome, Dr. Anna.
Thank you so much. It's so good to be here with you, Kyrin. I love our times together. So excited to serve you and your community and keep spreading the word of empowerment in our own health.
Yes. And Dr. Anna and I have known each other for many, many years. And we've had kind of parallel paths in our personal lives, in our professional lives. And we've both kind of been on this, what I call hero's journey for our own health, our own wellness, our own vitality journeys, and as well as professional journeys. So I'd love it if you could share with the listeners what your journey has been to where you are now, because most OB-GYNs who are board certified like us are in offices somewhere doing pap smears and prescribing birth control pills. And we're here on a Zoom podcast educating women globally about a different way to actually achieve a higher level of health. So I'd love for you to talk about your journey.
Yeah, and I'm happy to. I think the biggest thing is that, like God has used us to empower women to heal in a way that is that we're divinely designed to, so naturally. And as OB-GYNs, we're so busy. We are serving from our heart. I mean, there's no other, honestly, OB-GYNs are the most loving professionals there are, and, you know, giving of their time 24/7 and a lot of sacrifices. But the system's broken. The system's broken. So we find ourselves in busy clinics being monitored by insurance companies that have, you know, that have monitors with no medical background, and, you know, probably a lot more to say about that.
Yeah.
But it's really a shame. And so basically their hands are tied. I know my hands were tied, and it was a struggle to do testing and ordering things for my patients that they absolutely needed. So it came to the decision of like, okay, we have got to put healthcare back into our own lives to empower ourselves. It is our decision to be healthy, and it is our choices to be healthy. And so I encourage patients not to give that power away in any way, to, you know, take the information that they discern is right, that works for them, makes them feel better holistically, and, you know, better not drugged, right? And, you know, they get results with, they discern is their next best step, because there's so much misinformation out there. And there's, you know, over age 50, I'm 52 now, Kyrin. And it's like, you know, the insurance companies are just looking forward for me to die quickly, right? Take these medications, you know, let's keep the system going. But, you know, sooner you're out of here, the better, you know? And so it's a, you know, and it's really a challenge. Now, personally, my personal struggle at age 38, I was diagnosed with premature ovarian failure, early menopause, and irreversible infertility. I was told I would never be able to have a child again, and I was devastated. And it was a traumatic time in my life. And I left my practice for a year and traveled around the world looking for answers, just searching for answers. And my journey took me to countries all around, and indigenous healers and some of the world's leading medical scientists. And from that, I incorporated natural and traditional remedies to heal myself, and lo and behold, became pregnant and delivered a healthy, beautiful baby at age 41, the child I was told I would never be able to have. So I thank God for her, and I thank God for the journey he's put me on, and have since worked to inspire and help other women heal their hormones, heal their relationships, heal their lives.
Yes. And we're all the better for it, because I think that the world needs people like us who have the credentials and the medical training, the traditional medical training, but who had health issues that weren't necessarily addressed by mainstream medicine, and went on this hero's journey to find answers. And then we found them, and now we're bringing them back to our tribe. For me, it was very much that I became disillusioned with medicine, because I really saw that the people that we were treating never really got better, even though we gave them the prescribed birth control pills or did surgery on them. And then I discovered this thing called functional medicine. I was unhealthy as well, weighing 243 pounds and had all kinds of health issues. Then discovered this type of medicine and got on this path, and then feel this calling to bring this to a larger audience. So I'm grateful for the path that you've had, and I'm grateful for the path that I've had. And I'm so excited to hear about your new book that's coming out, and what new offerings you're going to have for menopausal women looking to live healthy, vital, vibrant, brilliant lives going into their older years.
I'm really thrilled about it, because this has been my life journey. It's been one of those things, you know, I created my online Magic Menopause program, and then I was contacted to write a book, you know, about diet for menopausal women. And so hence came my book called The Hormone Fix. And it's based on my principles of balancing our three most important hormones to create get us to our optimal wealth, to create a painless, pain-free, inflammatory-free existence, right? And a healthy brain, a healthy relationship. So I've really enjoyed writing the book. It's called The Hormone Fix. and it is subtitled Burn Fat Naturally, Boost Energy, Sleep Better, and Stop Hot Flashes the Keto Green Way. So it incorporates my keto green diet and lifestyle, and I couldn't be more thrilled that this is going to go out to millions of women around the world. And in my programs, I know that women from their mid-30s through their 70s, anywhere along this continuum when hormone changes start happening to way past post-menopause, is it's helping them. It's helping them transform their lives. And it's a beautiful journey. Many women have reversed their menopause like I did. And again, without drugs, without medications, but the right tools and the right knowledge and the right lifestyle that we have to discern is the best for us to honor our body. So I'm excited about that. And with that, I also have my Breeze Through Menopause 10-day masterclass that will be released, and that's coming out early February. And then the book is released February 26th. So really, really just so excited about this.
Yes, I'm very excited about it too. I love your keto green philosophy. Can you help listeners understand what that is and how that programs the body for fat loss and for improving health?
Yeah, absolutely. So in my keto green way, it's a modified ketogenic, but based on ketosis. The goal of ketogenesis is to use ketones for fuel. And so, yes, we can do it with very high fat, high protein, very low carb restricted diet, but there's a balance in between there. We're more able to do it between a low to, low carbohydrate, below 40 grams of carbohydrate a day, but those low glycemic carbohydrates, the greens, the alkalinizers, and it's not just, and so that's one big part. And I have my clients check their urine for their urine pH, and I want it to be greater than 7, so on the slightly alkaline side, and it does make a difference. So if someone says pH doesn't matter, it absolutely, pH doesn't mean anything, it absolutely does. Our blood pH is stable, our urine pH fluctuates on a daily basis. The more alkaline it is, the lower risk of metabolic syndrome, obesity, cardiovascular disease, hypertension, cancer, and all of that is very well substantiated. So I'm excited about that part. So it's not only food that makes us alkaline, and that's what I continue to teach in the book, the other ways, all the ways to get alkaline. Because you can be eating the best diet. That vegetarian who had cancer, what was going on? Was it stress? Was it, lack of vitamin D? What else was it, right? And so we address these other, essentially, spokes on the wheel, and then use intermittent fasting and healthy fats, because as women, we need fat for hormones and brain health, right? And healthy fats to get into ketosis, to get into that fat burning, ketone producing state, and periodically. And I think that's the really big missing piece that people aren't getting. So the combination of the two, and I've been doing this now since my eyes opened to it in 2015, early 2015, when I was struggling at 48 with menopause again, because I went through menopause at 38, reversed it, went through it again at 48, and reversed it yet again. So I keep saying I think I'm through it now, but we'll see. And that's when I figured there's something different. All those women that come to us, who are saying, I'm not doing anything different, continuing my lifestyle, but 5, 10, 15, 20, 50 pounds creep on during this time of life. Absolutely true. And that's why the Keto Green Way helps to reverse that. So yeah, I'm excited about that.
Yes, it is very, very effective, very effective. And can you talk more about, I'm sure that people listening are saying, well, she reversed her menopause. Can you talk more about what you mean when you say that and how exactly you do that?
Yeah. So, and often in other clients as well, because premature menopause, for me, we have to look at the cause. What's causing our hormones to be low? What's causing the decrease in our hormone production? And there are many things that can do that. So I am seeing women in their mid to late 30s with menopause symptoms, with FSHs over 70, over 80. And it's really very, very concerning. So what are the causes? We have to look at other things. So endocrine disruptors. What are the hormones? What are the hormone disruptors that we're getting from our environment that are affecting our body? Our body knows they're not real. We're not going to look at them as real. but they disturb our ability to produce our own hormones. So that's one. Stress is huge. For me, it was stress. It was post-traumatic stress. And there are other factors as well, but those are the two biggest factors that cause early menopause. So when we control those issues, our ovaries, our glands start to reproduce, reawaken. Our thyroid starts to reawaken, and our entire hormonal communication system is back in sync, is having good conversation again. So, and then your body just starts to recycle, begin its cycles again. You start to ovulate. We are designed not to have children when we're stressed out of our minds, right? Because that's not a time to be pregnant and nurture a baby. So evolutionary, our reproductive hormones shut down. And that can be one of the reasons that causes an early menopause as well. And so I've even seen women in their late to early 50s also just have their own body start producing beautiful levels of hormones again. And that's the ideal.
Yeah, and in some countries, they actually don't have the same hormonal imbalances once they go through menopause that we do, because their diet is different, because their environmental toxicity levels are lower than ours. And so, like Dr. Anna said, the hormonal system in the body really is, I equate it to the wireless internet in your house. You've got two parts to your communication system in your body. You have your hardwired nervous system, and then you've got your wireless internet, which is your hormonal system. And like she's talking about, part of the reason why we have so many hormonal symptoms and problems and premature menopause is because these endocrine disruptors come in from the environment, whether it's from plastics or chemicals used in our food packaging or the foods that we consume, and interferes with that wireless internet. And so what she's talking about is detoxifying, getting rid of those disruptors, and allowing the body's natural endocrine organs to reawaken and really balance out. And I know that you've had some great results with your Julva cream, Joyful Vulva, which I'm a happy, satisfied customer.
Yay.
With a lot of menopausal symptoms. So I'd love if you could talk about how you formulated this and what's in it and why it helps with menopausal symptoms.
Yes, I'm happy to. So I, as a gynecologist, I'm working in sexual health since 1999. When I first entered my private practice here in Southeastern Georgia, I had a client come to me who had ductal carcinoma in situ of the breast and was told she couldn't have estrogen therapy, but she was 63 years old and she was the CEO of a biotech company. And she said, Dr. Anna, I've waited months for you. You're from Emory. Help me. I'd rather die than live this way. I'm a woman of the 60s. My sexuality and my intimacy with my husband is really important to me. And I've lost all of that. I'd rather not live. And I'm like, shoot. Wow, what do you say to that? I'm like, okay, let me look in my doctor's bag. And honestly, I looked and I didn't have anything there. So I went to the research to find out what can we do? And bioidentical testosterone, DHEA were options for me. So I started, and for her, and so I started her on this. Let me tell you, she's in her, how old is she now? She's in her early 80s and she's publishing a book. She's out there. She's doing amazing stuff still. So 20 years of good health, good maintenance, good brain function. Her peers, nursing homes. Her peers, with walkers. Her peers with dementia. So yeah, maybe this did have a difference in her life. And I certainly, with testing all her quality markers improved. So that led me to, understand what I could use safely with androgens for women when it came to vaginal health, sexual health, and incontinence. So when I retired my practice in 2015, early 2014, and was weaning down, clients were like, look, we can't get anyone to prescribe us this stuff. What can you do? Help me, right? I'm like, okay, well, I'd already worked on a cosmetic line that we had a skincare line called Sexy Younger You skincare. And I was like, okay, well, I can make a anti-aging vulvar cream. Surely I can do this. And so that's what I went about creating. And so I studied the ingredients that I've used successfully, and also some new ingredients, including plant stem cells from the Alpine rose, which is a beautiful rose that grows in the Swiss Alps. And it survives the harsh conditions of the ice and snow and cold weather in the Swiss Alps. And so I'm like, oh yeah, and these stem cells have been studied for its resilience, anti-aging, antiviral properties. I'm like, this alpine rose defines women, right? And I was like, that has to come in my cream. And then DHEA, a natural bioidentical that our body produces itself. And it is, we know that healthy levels improve our resilience. Our great women with healthy levels of DHEA have lower levels of cancer, have lower levels of heart disease, have better memories, better sex drives, all of those good things that we want. Stress depletes DHEA in our body. So I incorporated, and there's great research with vaginal DHEA in helping women with vaginal dryness and incontinence, and certainly was my clinical experience as well. So DHEA, and then emu oil, coconut oil, shea butter for all their unique properties and ingredients. And that's how I created Julva after 3 years of research study and clinical experience. And it really, there's now over 40,000 users around the world with fabulous results. I mean, you read the reviews and it brings tears to my eyes every day. I'm just thanking God for this venue to be able to help women.
Yes, absolutely. And make sure you stay tuned till the end and look in the show notes, because Dr. Anna has a special offer for you.
Oh, a free trial for your audience.
Yep, free trial. Yes, and you're going to be doing some clinical studies, I understand, because it's doing so well in the future on it, to look at all the symptoms of menopause that it helps to heal. Is my understanding correct?
That's the goal. That's the goal. We're working on a pre-pilot study now.
That's awesome. That's wonderful. So for some women who have symptoms that maybe aren't alleviated by things that they can do themselves, what options are there for hormone replacement in women who are needing that?
Yeah. So first thing is to empower your own hormones, right? And so about my journey, I created Mighty Maca Plus, which is an adrenal adaptogenic formula, green drink. It's superfoods combined together to really help empower our body to detoxify, get alkaline, fight off inflammation, all of those good things. And now that's been around for almost 10 years. Next year will be our 10th year anniversary with users from all ages and all around the world, which is really exciting. It's a beautiful adaptogenic formula. And so adaptogenic means providing, whether you're being overstressed, your adrenals are over pushed or underperforming, these adaptogens can come in and help support the glands in their production. So predominantly by detoxifying, by giving nutrients, by decreasing inflammatory cytokines, inflammatory markers, all of those are the reasons that these adaptogens can help. And so with a Mighty Maca Plus, which has over 40 superfoods in it, that's one way. And a natural way, we see a decrease in hot flashes, decrease in sugar cravings, and those are really good things to be free from. And so that's one way, is using adrenal adaptogens. And then another way is to use bioidentical hormones. I mean, not to be so afraid of them. Like bioidentical progesterone is very, very beneficial. And I typically recommend that to women, certainly over 40, 45 with low day 21 progesterone levels that most of us have at this stage. And that can help with, had a client coming to me yesterday, and actually it's a woman I walk with. And she's 46 years old, super young, super healthy, just an amazing lady and incredibly intelligent. And she's like, I'm just struggling. I'm struggling in my relationship. I'm struggling in my marriage. And I said, well, what's going on? And so she was telling me, she goes, I don't understand. Like, he didn't put I had clothes that I folded on the bed and he put them on the counter and I just blew off the handle. And I'm like, well, where in your cycle were you, out of curiosity? And she's like, well, I'm on day 2 and that was 4 days ago. I'm like, okay. So I always tell clients, if you hate your husband 2 weeks out of the month, it's your hormones, not your husband. Although of course they have something to blame with good reason to get boundaries. But I'm like, that's hormonal. Let's get this fixed. And so adrenal adaptogens, again, detoxification, cycle day 14 to 28 progesterone, that can help tremendously. We don't need to suffer through this. And so those are three predominant ways that I would work with clients to help balance their hormones. The other, again, with detoxifying, we want to detoxify the excess estrogen at this time and support our body's natural production of progesterone, which has to be done with stress relief, which has to be done with meditation and a good night's sleep and, establishing good relationships, so all of those things.
Yeah, and just what Dr. Anna's talking about, because in the body, cortisol, stress hormone, and the sex hormones, estrogen, progesterone, testosterone, there are 18 different hormones made in the adrenal glands. Well, they can all transform into each other. And particularly cortisol, stress hormone, when it's activated because there's stress in life, whether it's emotional stress or physical stress, will draw that progesterone to lower. And progesterone, like I like to say, is the weight loss, diuretic, anti-depression, anti-anxiety, sleep well, feel good, happy hormone. So when you lose that, you're going to hate your husband 2 weeks out of the month. So I agree wholeheartedly with everything that you've just shared about restoring the hormones, decreasing the stress, using the adaptogens, and using a progesterone cream, which wonderfully is actually over the counter, so women can just buy that themselves. And let's talk a little bit about inflammation, because I know the Mighty Maca does great things because of the superfoods and antioxidants that it contains in lowering inflammation. But I don't think that a lot of women are really aware about the role that inflammation plays in causing chronic disease, dementia, heart disease, et cetera, et cetera. So let's talk about that and how it affects your health and how to know you have it and what to do about it.
With estrogen dominance?
Well, that or with any type of inflammation from toxicity.
Yeah.
Yeah.
So, when we're talking about, I think the biggest thing that I want women to understand with hormone balance, and as we're getting older, right, as estrogen levels start to decline, is that, progesterone levels are declining even faster. And so we get into the state of estrogen dominance, even when there's like estrogen toxicity at the same time from these endocrine disruptors. And so that's why, estrogen is important for us, important for our brain function overall. I mean, it's a necessity. Mm-hmm. But we have to have healthy, optimal, clean levels of it. It's just like when we're in Southeast Georgia. So there are certain rivers we want to fish from, and there are other rivers we do not want to eat from, right? They're completely polluted. The same with detoxifying hormones from our body. So we want to send our estrogen down healthy pathways. And in order to do that, we have to improve our gut health, our microbiome, which we have an estrobolome. How do you say that word? Estrobolome, something like that. Estrobolome. And that is, bacteria within our gut, different from men, different proportions in relations to men, but that actually work to produce estrogen. So that has to be optimized. And that's why, again, the keto green diet works so well between intermittent fasting, wildly diverse greens, and getting alkaline can really help support a healthy estrobolome. What I believe, we need research to follow that up, though.
Yes, and I would just add to that, there's an enzyme in the microbiome that both men and women have that produces something called beta-glucuronidase. And if we don't have normal levels of that, then we can have a problem where we actually don't properly excrete the estrogens, excess estrogens, because that's how they're excreted, is through the liver and through the gut. But if we have abnormal levels, we actually end up reabsorbing that estrogen. But like Dr. Anna's saying, we really have a problem with estrogen toxicity. And so the standard treatment among gynecologists for menopause is to give estrogen. I'm happy that they're switching from horse estrogen to at least a biologically identical type called estradiol, which is one of the types of estrogen that women have. However, they're really neglecting the progesterone and giving progestins and not recognizing that really 85% of women who are menopausal don't have an estrogen deficiency, because we have fat tissue that makes estrogen, and we have estrogens from phytoestrogens and xenoestrogens, phytoestrogens from plants, and we have xenoestrogens from the environment. And so most of us just have these really high levels of estrogen and don't really need more, but what we need to do is have the progesterone. Progesterone is actually anti-inflammatory as well. So those are all very important to balance. What do you think is most important for women approaching menopause, or who are in the middle of it, who are gone through it already, to do for their health? What are the top 3 actions that they could take today to move towards being healthy and symptom-free?
Yeah, the top 3 action is, the first and foremost is to develop an attitude of gratitude. And that is not, it is not, you know, simple science. It is really good hard science behind this. And it is creating that attitude of gratitude. I mean, I always say, I coach my women in Magic Menopause that, you know, we have to have a cheer word that brings a smile to our face every day. Smiling increases our oxytocin production. I mean, increases our physiology, changes our demeanor. You know, so being happy, creating some general ease in our life makes a difference, but more so from my point of view is I want smile lines, not frown lines. You know, I want a resting happy face, not a resting witch face. You know what I'm talking about? So I think that will, you know, that in and of itself definitely does help. And just thinking of a word that makes you happy, that brings a smile to your face, that is just a really good process to begin. So an attitude of gratitude, what can we be grateful for? And that is, first and foremost, the thing that's made the biggest difference in my life, you know, dealing with physical struggles, emotional struggles, relationship struggles. I mean, name it, I've been there, right? And so, and then the second thing is really developing a keto green lifestyle. And I go into details on what that looks like in my book, with even a 21-day menu plan and a 10-day quick start. So share some of my tricks of the trade that really help with that. So develop a keto green lifestyle and really work on that. And the third thing is to build a community that you love, that you are able to share in, you're able to mentor and be mentored by. Create a really good, safe community. Stay connected with others like us here, and you're going to come down and visit me, and, you know, staying connected with like-minded people that inspire you to do more, not to give up, or not to say you can't do it, but to encourage you, like you always do for me, to do more, to connect with God's purposes in my life, and go for it. Never too old, right? And we have just what it takes. It's our journey, uniquely created, and let's go for it. So those are my 3 golden nuggets.
I love that. So what is your word that brings a smile to your face? Do you have a word or words?
I'm very simple. It's smile.
It's
smile most days. It's just like, we're gonna smile. And then that brings in like all the things that I can smile, that make me smile. Like my daughters, my dog, you know, like what I did yesterday that made me smile. I mean, that, how I can laugh at myself, that makes me smile. So that brings in that. But I've also used the word jiggle.
Jiggle? That'll make you just laugh just because it's a funny word.
Yes.
But I love that the research does show that if you just laugh or smile, you do improve your mood, even if you didn't do it spontaneously. Mm-hmm. So just putting on a smile or laughing, there's something called laughing yoga, actually will improve your mood and improve your cortisol status. So I love that. So Gratitude, absolutely. I agree with that. And then the keto alkaline lifestyle is awesome. And community, that increases what Dr. Anna was talking about, that oxytocin hormone, and that sense of bonding and belonging. When I do my boot camp, which I have women going through it now, it's so funny because usually everybody's gung-ho the first 3 weeks, and usually around day 21, they hit the wall and they say, I don't want to do this. But what I help them see is that they're not bonding with each other. And part of losing weight and getting healthy is realizing that that's a community event. It's not an individual event. And we'll only ever be as healthy and normal weight as we are connected to each other. That weight problems are kind of a disorder of shame. It's shame-based. And so I kind of talked with them the other day, and we did this meditation and got them interacting. And now they're blowing up my Facebook Messenger, supporting each other. How are you doing? What can I do for you today? And really connecting. And so I can't emphasize that enough. I know that you've been a tremendous support to me, and I hope that I have been a cheerleader for you, because I'm so proud of you. I'm so excited to finally see your book, because I've been waiting for it for years. So we try to live that.
Mm-hmm. Absolutely.
We can't not talk about sex, because your program, Sexual CPR, so many women, right? How many women did you have come to you when you practiced regular gynecology who said, I don't care if I ever have sex again? And maybe if you're listening, you can relate. And they just kind of gave up on ever having a satisfying sex life. And if you're listening and that's you, absolutely not. There's no reason that you shouldn't have healthy, vital, passionate, fulfilling sexual relations well into, like what your patient said, in your 80s. So talk about that.
Yeah, absolutely. And again, especially like if you're like me and I'm 52, not in a relationship, single mom, divorced over 9 years now. And, you think, okay, well, eventually for me, I'm raising my daughter. Eventually I want to have that relationship with someone really special. And so, what will that be like at that time? Right. And I hear that from so many women, like, I don't even want to have sex. Here I am, and hear from so many women, here I am on a dating site. And honestly, I can't even imagine have sex. So what I want to just assure is that when you have your hormones balanced and you meet the right person, that will shift and you will want to have sex. So keep your body balanced. So you're in that position, right? You're in that frame of mind for that soulmate that you'll meet and marry and love and spend the rest of your life with, right? So we want that for you. I want that for me. I want to celebrate still 50 years of marriage down the road with my life partner, with family around us and their kids around us. It may not have looked like what I initially, when I was in my 20s, wanted it to look like, but I am goal set on that, filling chairs for generations of loving, caring people around me that I've nurtured, romantic relationship with my soulmate, mate for hopefully some, I don't know how old I'm going to be at that point, but many, many years. Right. And so, and that's like the end goal. Keep the end goal in mind and have intimacy, connection, want to continue, love to put arms around each other, love to hold each other's hands, love to kiss each other. I mean, let that continue to be part of your life. And when our hormones are changing, can feel completely disconnected from that, not want it, or even be repulsed from it. So I want to encourage you that getting your hormone balanced, and that resentment is lack of self-care. Resentment is lack of self-care. And that means your hormones are out of balance. Cortisol is winning and oxytocin is losing, and you can't feel connected. And even a temporary relationship or fling will not last in that connection space. And many women will probably have already experienced that. And so, so here again, I also, working with women and in sexual health, keeping vaginal tissue healthy is really important, because believe it or not, that dryness is starting in our late 30s, early 40s. And if you have discomfort every time you have sex, why would you want to have sex? If you have discharge, urinary infections, odor every time you have sex, why would you want to have sex? I mean, I've experienced it too. Remember, I was 38, diagnosed with early menopause. Hormones were tanked. And I experienced all those things, a complete turnoff. And it's not something I put together till maybe many years later. Did I recognize that there was that negative feedback that I had in my life. And then I could ask questions to my patients and understand what was going on for them. And they had huge aha moments from that, and could work on the many aspects that improve sexual health between couples in a relationship, in a marriage. Because I think that's so important. We need to understand that when we're when we are disconnected in our relationship, there's some physiology to that often. Mm-hmm. And we have to look at that, because otherwise it repeats itself over and over again until we get to this core issue.
Yes. And so I agree with Dr. Anna, what she's saying. Yes, there's a physiologic component. If you have vaginal dryness, if you have hormone imbalance, your sex drive is probably going to be low. But like when I work with clients one-on-one, what I always help them to understand is that having healthy vaginal tissue, having balanced hormones is necessary, but not sufficient for an adequate sex drive. And I love what you said about resentment is lack of self-care, because if you're having resentment in your relationship, that's absolutely going to cut off your sex drive. What women need to understand is that 80% of our sex drive is in our brain and 20% is probably in our genitalia, whereas it might be the reverse for men. So if we have mental, emotional, spiritual issues going on, we're not attending to our needs, we're taking care of everybody else, we're being a human doing rather than a human being, we're not connecting emotionally with our partners, then we're going to have some degree of resentment that cuts off your sex drive right here. It doesn't go below. So really loving yourself, caring for yourself, nurturing yourself, setting those boundaries that Dr. Anna mentioned earlier, and giving yourself what you need instead of caring for others and then expecting them to give to you what you should be giving to yourself is a whole other topic. But this is a lot of what I work with people on when I do my group program, and I know you do too, is really how do we nurture and love ourselves so that our physiology reflects that, because it actually does. Yeah.
No. So I love everything you said, and that just mission to keep awakening our spirit, awakening our soul, and the self-care that's necessary for that, the good boundaries and clarity, and knowing that we are worth it, knowing that we are absolutely worth it. We're worth the time, the investment, the space. It's necessary.
So I'd love to talk about that, because I find with women whose health has kind of gone off the rails, this is always, always, always a centerpiece of getting them back to center. And how do you work with women and help them to understand, like in your Magic Menopause program, about boundaries and self-love and self-nurturance? How do you help women with that?
You know, it's really, I had to figure it out for myself too, because I think like so many other women, it's like, let me take care of everyone else. I'm the last person on the to-do list, and, you know, and that's not going to get checked off, or something else will take its place very quickly. So it's important to, first of all, really have the end goal in mind. Like, what's our end goal? What's our ultimate purpose? And any of these other distractions are just a no. If it's not a heck yes, it's a heck no. And so that was the first thing I had to learn. The other second thing, and that's what I teach my clients, is that practice of discernment. So are we doing something based on love or based on fear? And in all aspects of our life, like, is this food and then just thinking in discernment, is this food we eat good for me? Is it going to love my body? Or is it bad for me? Is it going to send cells screaming and running away? You know, what are we doing, and how are we discerning what's good for us and what's not good for us? And it has to be based on love, has to be based on caring, has to be based on nurturing and nourishment. And so that's the way that I really awaken women to get rid of all the myths, the lies, the the misconceptions that they have over what they should be doing or should be feeling. It's like to get in touch with your inner being. What are you really feeling? What do you really need to be doing? And what makes you happy? So, Kyrin, I'll just share this with you. We've covered a lot of stuff, but one thing that I started asking myself recently, because I always do the St. Ignatian examine or daily examine prayer. I do a like Cliff Notes version of it, I'll call it. But one thing I started asking myself recently is, what did I do yesterday that I'm so glad I did? You know, what did I do yesterday that I'm so glad I did? And it's typically not, drink wine, binge eat chocolate, sit on the couch and work all day. Okay. Yes, I have those days. But it is typically thinking yesterday, it's cooking for my family, talking with them all around the counter while we're eating and just loving on them and being part of the conversation. No cell phone anywhere to be found, no work on my mind, completely present and engaged in the situation, even though you and I both have a to-do list that's 10 feet tall. So that's, and then other things like I'm so glad I went for a walk in the evening with my friend the other night and we power walked and power talked. I'm so glad I did that. I could easily have said, I am just too exhausted. We put it off till 8:30. And I'm like, I need to shower. You need to take my hot bath in bed. But I'm so glad I did that. So, that's what we need to start evaluating. What are the things that we value most in our life? And let's do more of those. Let's do more of those. So that question is a transformative question. And it's an eye-opening question. And it's a reality check-in question. And so I encourage your audience right now to write this down. What did I do yesterday that I'm so glad I did? What was my oxytocin moment yesterday? What did I do that just filled me? So
yes. I love that. And really getting clear on what you value and what brings you joy, because we're not here to get our to-do list done. In case you didn't know that, if you're listening, we're here for the joy. We're here for the expression, the evolution, the connection, and expressing our unique gifts. I really believe that we each have gifts that were implanted in us before we came here that we are ours to share with others, and that if we don't share them, it's been said that if we bring forth what's within us, it will save us. And if we don't bring forth what's within us, it will kill us. And so really helping women to see that, yes, what you bring to the table is unique and special, and looking for the joy. So thank you so much for sharing that. And I have to ask you, the name of the podcast is Her Brilliant Health. How would you define Her Brilliant Health?
That's a great question. That's a great podcast name too. I want to soak in that, Her Brilliant Health, because it's a visual, it's a visual of a woman just shot, for me, just adorned in light and colors and radiant and just, highly energetic and loving and kind. So I would define Her Brilliant Health as being in touch with your soul purpose, being so connected to who you are, the Holy Spirit within you, that you live in this space of being present each and every moment. That's what, that is for our energy, our Holy Spirit, energetic body within us radiates through a fabulous physical body. A healthy physical body. It is housed within our, temple, the temple of our spirit. So keeping this aspect, the shell of our energetic body healthy is key to that. It's key to that. So, that took me off in this huge visual, Kyrin, but I love that.
I was right there with you. I was right there with you. Had my eyes closed and everything. And I will say that you exemplify exactly what you just described. And I'm so grateful to call you my colleague. I'm grateful to call you my friend. And I'm so grateful that you chose to spend some time with us this morning talking about what I'm passionate about too, is natural women's health, creating optimal vitality, healing, and living a soul-filled, fulfilled life. So thank you so much for joining us.
Thank you. Thank you for this time and this opportunity and this connection.
Thank you for joining me for this episode of Her Brilliant Health Radio. Hopefully you're inspired to take action on some new information you received today, a step towards the bountiful, blissful, beautiful vitality that you deserve. If you have health topics and questions you'd like addressed, please message me on my Facebook page or visit KyrinDunstonMD.com and let me know. I'd love to help. Remember to share this podcast on social media and send it to your friends and family who could benefit from it too. If you love the show, please go right now to iTunes, write a review, and make sure to subscribe to the podcast so you'll be the first to know when future episodes are available. Thank you again for joining me, and remember, achieving optimal health isn't magic, it's science.